A Caesarean section or Caesarean delivery procedure comprises of using a surgical method. That means we delivery of a child through an operation, a surgical operation. That involves making a cut usually on the mother's abdomen and going through the layers of the abdomen until the womb is reached, and the baby is removed also by making a cut on the womb. It is classified as a major operation. So in medicine we have what we call major operations and minor operations. So this would be a major operation. However, it has become safe, relatively safe, in the many years that we've been doing cesarean sections. And that means that it is commonly done, and people usually end up thinking that it is a relatively harmless procedure, but it actually does carry a lot of risks to it. The most basic reason why they've gone up is because of the technique has been perfected over time. So people are more comfortable to do it, and it has also evolved as one of the methods of ensuring optimal outcome for newborn infants. However, those are the positive things that have led to its increase in use. However, we must say that also some cesarean sections that are done nowadays are not strictly speaking necessary, and maybe because of maybe fear of normal birth has led to people opting to deliver via cesarean section. So there are a multitude of factors. So I'd say some are necessary, some are debatable why they are being done. Yes, we found with following up these children or babies that have been born normally versus those that are born via cesarean section, we have seen that there's a lot of benefit in a natural birth process. Okay? When the baby is passing through the birth canal, it is exposed to, let's say, microorganisms or some sort of bacteria, okay? And this helps the baby to develop a good immune system, okay? Now, if a child is born via cesarean section, they do not get exposed to that same amount of bacteria, and their immune system does not develop to such a level, I should say. So you'd find that they tend to have a slightly altered immunity, and sometimes they can even have a higher incidence of allergies. So that is a variation we've noticed that happens between cesarean delivery and natural delivery. When we talk about cesarean delivery, we have two main classifications. The first one is what we call emergency cesarean section. So this means that the mother was not intending to have a cesarean section during the delivery process, but because of complications happening in the delivery, then it necessitates a cesarean section to be done. Then we have the elective, like you've mentioned, whereby the delivery is planned in advance to be a cesarean section delivery. Okay, there could be some good reasons why someone would opt for an elective cesarean section delivery. A lot of these mothers who request for or are scheduled for an elective delivery probably have those conditions. And what are these conditions? Okay, number one is maybe choice. So some mothers just prefer to deliver by cesarean section. we can respect that choice if the mother is fully aware of the risks of a cesarean section and she is willing to undertake those risks. Okay? Then, other than just choice, somebody wanting a cesarean section, there are other good reasons to have cesarean section electively. For example, if the mother has medical conditions like diabetes, or she has high blood pressure, or the baby is not situated normally, the baby is in an abnormal position, or sometimes you find that the placenta, which is where the baby receives its nutrition from, is blocking the normal passage of the child if it was to be delivered normally. So those are some of the reasons that would necessitate an elective cesarean section. The conditions that might arise is maybe slow labor, that the labor process is happening very slowly, and the baby gets tired. Okay, so throughout the labor process, the baby needs to have adequate oxygenation, just like adults need to breathe air to maintain good health. So is the baby as it is being born. So if the labor process takes very long, the baby starts getting less oxygen, the baby starts getting tired. This can lead to complications such as brain damage later on in life. Okay, so that is one of the most common causes of doing an emergency cesarean section. Other things could be, for example, bleeding, excessive bleeding that is happening during labor, or like we said, the baby is in an abnormal position, which makes it very difficult for normal delivery to progress. So those are just some of the factors that can result in that emergency cesarean section. And the reason we do it is to avoid a bad outcome, because it is very difficult to explain to a mother she has carried a child for 9 months, and then during the delivery process, that's when the complication happens, and she ends up either complicating herself or having a problem with the baby. So usually we want to avoid that, and that's why we do the emergency cesarean section. Like we said before, a cesarean section is not a harmless procedure. It is a major operation, and it is fraught with risks which can be life-threatening and can even lead to death. Now, every subsequent cesarean section that a woman undergoes increases those risks. Okay? So that is why you find that some clinicians would advise women not to have too many cesarean sections. The rough number there is 3, maybe 4. Why is this? Because a cesarean section, once it is done, the next time a woman falls pregnant, she is exposed to further risks that a woman who has never had a cesarean section would experience. One of the greatest risks is a weakness in the womb, because remember we said when you do a cesarean section, you have to cut through the womb to extract the baby. That womb, even if it heals, it has an area of weakness. Okay? And if a woman falls pregnant again after that, that area of weakness can separate. We call it rupture. Okay? So that is a big risk to a woman who has had a Caesar before and she falls pregnant again. Another thing that can happen is that not only can the old wound rupture, is that the placenta, which is where the baby receives its nutrition from, can abnormally stick to the womb, especially on that previous cut that was made. It can abnormally stick, and we all know the placenta or the afterbirth is supposed to be delivered soon after the child is born. Okay, even in a normal delivery, we deliver the baby and the afterbirth follows. If you have a placenta that is abnormally stuck to the womb, it can cause severe bleeding, which is life-threatening. And that usually increases after a woman has had a cesarean section. The risk increases. Another complication that can happen after a woman has had a cesarean section is an abnormal growth in a next pregnancy, a subsequent pregnancy. So we call that a cesarean scar pregnancy, so whereby the pregnancy starts growing within the old scar that was created. Okay, and that obviously cannot be a normal pregnancy. It usually has to be terminated. So because of those risks, the risks of also heavy bleeding, the risks of infection, the risks of what we call blood clots on the legs, on the lower limbs, that usually happens a lot after cesarean section, much higher than if women deliver normally. Based with all those risks, we find that unless there are good reasons for a woman to have a cesarean section, we would rather explain all those benefits and the risks and let someone make an informed decision regarding the C-section. But like we said, every other C-section that someone has, that risk keeps going up. And that answers the question as to why some doctors would want to limit the number of C-sections that a woman should be exposed to. One of the main benefits, like we've said before, is to avoid brain injury to the child during the labor process. Okay, so if for example the labor is taking too long, or there's another complication during the labor process, you want to do a cesarean section so that the child can be born quickly, expeditedly, to avoid a risk of brain damage. Another benefit of a C-section is to prevent, sometimes you would hear people talking in simple language that the baby got stuck. Okay, it's a condition we call shoulder dystocia, which can be life-threatening to the baby if it's not handled quickly. So, benefit of a C-section, you avoid that during the normal labor process. And also, there are benefits to the mother. Like, remember we said if she has medical conditions, diabetes or high blood pressure, we would want to deliver her by cesarean section to prevent her medical conditions worsening. We know that conditions such as blood pressure sometimes tend to get worse the longer the pregnancy goes on for. So if we find that there's a worsening in the mother's condition, we do the C-section delivery. A normal delivery is by far better, both for the child and for the mother, than a cesarean section. Why do we say this? We can think about benefits to the mother, for example, and benefits to the child. So for the mom, there's a much quicker recovery from the delivery process if it is a normal delivery compared to a cesarean section. Also, there's that integrity of the womb. Remember we said that once a woman has a cesarean section, the womb has to be cut to deliver the baby. That means her subsequent pregnancies, she's dealing with a weaker womb that could rupture or something. But when you have a normal birth process, then the integrity of the womb is maintained, and that means subsequent pregnancies are not at any higher increased risk compared to the previous pregnancy. There is also less bleeding that happens with normal delivery. Cesarean sections usually tend, because of the process of surgery, we all know that surgery has bleeding associated with it. So there's less bleeding that occurs. That means the mother has a lower risk of having complications of excess blood loss. There is also a reduced rate of infections to the mother and also to the baby being born when we have normal delivery happening compared to cesarean section. So that reduced incidence of infection is very advantageous. Infection sometimes can lead to mortality, but even if it does not lead to mortality, which means a death, it can cause a lot of downtime. So someone needs to take time to recover, and maybe they have long-term consequences of the infection that they acquired. Benefits to the child. We said that as the child or the baby passes through the birth canal, it is exposed to a lot of microbes, or bacteria we should say, which help to boost or to build up the child's immunity. Okay, so you have an immune system on the baby that develops well. It also reduces risks of allergies. We found that children who are born naturally tend to have less allergies than children or babies that are born through cesarean section. If you think about a normal delivery from the onset of labor, from the time a woman first experiences the labor pain until the child is born, then we would say that a normal delivery takes longer than a cesarean section. But if you were to actually just limit it to the birthing process, the time that the actual birthing process, a normal delivery is just about as quick as a cesarean section. The average time of a normal delivery from start to end, from the onset of labor, is anywhere roughly between 8 hours up to 24 hours, depending on if it's your first pregnancy, second pregnancy, and also other factors like body size and the size of the baby, etc. A cesarean section delivery, on the other hand, usually has a standard time, unless there are complications. So how long does it take? Usually, give or take 45 minutes, 1 hour. Okay, if it is being done without any added complications. Recovery time after delivery for a normal delivery is much quicker than a cesarean section delivery. So usually within 24 hours, a day, 2 days later, after a woman has given birth naturally, she is pretty much on her feet and able to, to mobilize or to walk around and do some small basic tasks. This is opposed to if someone has undergone a cesarean section, where they need, we usually say, about 6 weeks to heal sufficiently that they can resume their normal day-to-day activities. Financially, normal or natural deliveries tend to cost less than cesarean section deliveries, and there are reasons why it is costing less. The main driver for cost for cesarean section is the theater time. Okay, having to go to theater, having to have to maintain a facility that is able to conduct deliveries. So that usually costs money to run. Having a theater nurses, theater equipment, the anesthetic agents that are used, all those tend to cost money. So that's the main thing that drives the cost of a cesarean section. The immediate complications of a cesarean section. Number one, we said it is a surgical procedure. So just by the fact that someone is cutting through the woman's body, there is a risk of bleeding. Okay? And that bleeding can be heavy in some instances, requiring even a blood transfusion. Okay? And if the worst happens, it can lead to death. Okay? So that's a big major factor in when someone is considering a cesarean section. So after bleeding, the other big complication that can happen is infection. Again, we said it's a surgical operation, this cesarean section. The woman's body is being opened. It increases the chance of infection going into her body. Okay? So the risk is higher than natural birth, for example. Alright? Another complication that women can have when having a cesarean section is, we've mentioned it before in passing, but is the development of blood clots. Blood clots can happen in the legs, can happen also in the lungs. Why do women who have cesarean section have a higher risk of blood clots than women who deliver normally? It's because of the period of immobility. Remember, after the cesarean section, you would find that most women have to be on bed rest for a while to help them recover. that period of immobility tends to increase their risk of blood clots. Another complication that they tend to have is now the pain that they experience on the site where the surgery was done. Okay, so we call it incision pain. So a lot of times you find that they have to be on high dose painkillers to be able to tolerate the pain of the Caesarean section, which you don't find in, for example, natural delivery. There's no much pain after the birth has been completed. Okay. For the baby as well, there could be complications in Caesarean section. Sometimes, especially if it's an emergency Caesarean section being done, you find that there's a risk of a small nick or a cut to the child as the womb is being opened, because we are using sharp instruments, we're using sharp blades. So sometimes it's never, of course, deliberate, but sometimes you find that the baby gets cut or injured in the process of the Caesarean delivery. And also the child can also be, like you said, has a higher risk of getting allergies after birth and reduced immunity compared to those who are born normal. So you find for, of course, millennia, women have had to endure quite a lot of pain during the labor process. However, now with modern medicine, there is the option of giving pain relief during labor. That is actually encouraged, because labor can be a stressful process, and if we can relieve some of that stress by alleviating pain, that is encouraged. What are the pain relieving options that we have? One of them, the most commonly used one, are just pain injections. Give a drug like it's called pethidine or something, which tends to reduce the intensity of the pain the woman feels during labor. That one has to be given in intervals. So if the pain recurs again during labor, you add another dose. Another option that is commonly used nowadays is what is known as an epidural. Now, an epidural is just a scientific term for an injection that is kept in the back of the lady that numbs the nerves or that communicate the pain signals from the womb to the brain. So once those nerves are numbed, then the woman feels no pain. So we call it actually painless labor. So that is actually done nowadays. Sometimes these pain medications tend to lengthen the duration of labor. Some people have argued that that lengthening of labor can have some effects. But by and large, I think the benefits of pain relief are better than having a slightly longer labor. So if someone wants to ask about pain medication or pain relief during labor, it would definitely be recommended in the birthing process. Patient education is very important to improve the outcomes of both mothers and babies. If you look at the ranking of maternal health and child health globally, you'd find that developing countries, Kenya included, tend to do very badly in maternal complications, in maternal deaths, in child complications, in child deaths. A lot of these complications arise from lack of information. Sometimes the interventions required to reduce these complications are very simple, but because people do not know, they are not informed, you find that these complications end up happening, and they are recurrent. So they'll happen to this mother, they'll happen to another mother, they'll happen to another mother again. So patient education is very important. That's why we recommend that women, when they are pregnant, to attend antenatal clinics, reputable antenatal clinics, whereby they can be assessed during the progress of their pregnancy. If there are any medical conditions that the woman is suffering from, example, those can be managed in the antenatal period. I hope with that discussion about cesarean sections and also normal delivery, it has helped to maybe dispel a few misconceptions. I hope it has been, informative to most of the people who had probably not had a chance to be exposed to what a cesarean section entails, what a normal delivery entails. So I think with those few remarks, I would say asante sana for the opportunity to share this information with you.
Nani alisema mimi si mtoto wa Mungu? Mimi nakwambia matajiri wanakuanga wametarau watu sana. Mtos, habari ya asubuhi?
Nzuri sana.
Unachoona unaongea na milionia sahi. Mimi nimekuja tu kukuambia